Do you want to learn how to cannulate or perhaps take bloods after cannulation?
Welcome po ulit dito sa ating channel, Adobong Briton. Today po, we will show you how to do a intravenous cannulation. Dito po kasama natin si Nurse Jonathan Juco to show us how to insert a cannula. So before we start po, we'll show you all the things na kailangan for cannulation. Okay, so ito po si Jonathan will show us.
So we need extension.
Okay.
Ito ba? Cannula. Gloves. And IV cannula pack insertion.
Yan, IV cannulation pack.
IV cannulation. Okay. Good. First thing to do is to clean the trolley. Okay. To open the cannulation pack.
So what do you have inside the
The
cannulation?
cannulation pack.
As you can see here, Jonathan maintains a septic technique by trying to open the pack and only holding the edges of the pack to maintain a septic technique.
We got the saline.
So that's the saline flush.
We got alcohol swab. We got the extension. We got the cannula. And we got the gloves. Okay. After preparing the pack, we need to wash the hands. Dry your hand. Okay. You got an apron. You got the gloves. Put your own gloves. You need to prime the extension. Okay. You got the drape to put to the patient. You got tourniquet. And you got the dressing. These are the basic things that you need. Got the cannula, extension, and the dressing. Okay, and now we got the tourniquet. Now we need to put the cannula now with the patient. Okay.
So first of all, we apply the tourniquet and identify our vein. As you can see here, there's a big vein in the radial area. So initially we clean the area with alcohol wipes and try to disinfect it. As you can see, we've got a very long vein in there. Right, hold your needle 15 to 30 degrees and insert it into the vein. Backflow of blood is noticed here at the chamber. Using your index finger, secure cannula in place. Using your thumb and middle finger, slightly pull needle back. Advance cannula into the vein and observe for continuous backflow of blood into the chamber. Secure cannula in place. Press the vein to prevent backflow, then remove needle in situ. Taking blood samples right after cannulation. Keep your finger pressed on the vein, then insert vacutainer holder into the cannula. Once vacutainer is inserted into the cannula, you can now let go of your finger. Now you can take blood samples from the newly inserted cannula. Remember, the tourniquet at this point is still in situ to keep the vein dilated. After blood taking, we can now release the tourniquet. Secure the line in place. Press vein again before removing the vacutainer to prevent backflow of blood. Connect line extension and press the vein, then flush cannula with saline. While slowly flushing cannula with saline, you should observe for any signs of extravasation. Number 1. Ask patient if there is pain on cannula site while flushing. Number 2. You should observe for any forming of wheal or bulge at the tip of cannula site while flushing. Finally, secure cannula with dressing and put the date of insertion. Make sure the IV cannula insertion is properly documented into the medical notes and nursing notes. And if you're using any electronic data recording, this must be entered into that as well. Proper documentation and monitoring of IV cannula will prevent any infections.
So there you go, guys. That's how you
Cannulation.
cannulate and taking bloods. Okay, and once again, thank you to Nurse Jonathan Juco for showing us how to cannulate and take bloods from patient. Thank you.
Thank you.
All right. Bye.
Bye.